Hello, this is Eddie Barragon. This is my presentation on the blood-brain barrier, where I break it down and give some examples of its importance in the physiological health of the human body. Thank you for considering my presentation. Thank you. Hello, this is Eddie Barragon. Um, so to introduce my presentation, I would just like to explain the structure of the blood-brain barrier. Often referred to as a barrier, hence the name. It's actually more of a filter. It tends to process a lot of the soluble liquids and materials that certain drugs would be having a hard time permeating into the circulatory system and thereby spreading into the nervous system. Um, it is, an exceptionally important and vital part of maintaining the health of both the brain and by extension, the nervous system and the circulatory system as a whole. It is mostly what keeps a lot of toxic substances or potentially hazardous or dangerous substances from entering the nervous system and the brain overall. So what is the structure of the blood-brain barrier? The lining is relatively thin, so it doesn't offer a lot of protection from the environment or from the elements. It's really not structural in its protection. It really is more functional. It is made of, very tight junctions of, capillaries that, as the illustration shows, astrocytes and endothelial cells and capillary structures form little teeny tiny tight barriers that form up what could be referred to as the matrix of the blood-brain barrier. It's essentially, as noted, a very highly compacted filtering and traveling system, traveling for both the informational sending, the neural synapse messaging, as well as the physical sending of solubles and materials and certain substances that would diffuse and dissolve within the brain tissues itself. Um, so basically it is essentially just a junction between the brain overall and the surrounding circulatory system network around it. It really is more like, I guess to put it analogously, a good comparison would be, I know as a comparison, it would be most kind of like a washer, like a thin metal washer between, say, um, a metal instrument and the structure behind it, so that there's no physical impact between the two, and it's able to be lubricated and provide a bit of a protection on both sides, with the additional functional aspects of the blood-brain barrier as well. Two main advantages of the blood-brain barrier that prevents the passage of pathogens, and it restricts the diffusion of solutes in the blood. What that means is it does have, even though I said before that it is limited in its functional value in terms of preventing the passage of physical particles into the brain tissues itself, it is limited, but it still has a function in that part. Basically, a lot of pathogens, viruses, and bacteria would have a slightly more difficult time penetrating and bypassing the circulatory system and getting to the brain tissues were it not for that blood-brain barrier there. In fact, its purpose as a filter does help out almost completely eliminate certain pathogens and bacteria or certain things like that would be of a certain size that would not be able to get into the brain tissue and past the matrix itself. The main secondary beneficial aspect of it is it restricts the diffusion of solids. And what does that mean? So what that means is certain chemicals, toxic substances, and even in the case of controlled substances like drugs, for example, they have a limit in how much they can directly impact the brain or the nervous system overall because of the diffusion and lack of solubility that the blood-brain barrier helps in the um, in the protection of the brain tissues in that aspect. Were it not for that substance, were it not for that particular layer of defense, it would be a lot more easy for and direct for certain substances to take effect. A good example of this would be local anesthetics, right? So anything that um, temporarily puts the body into a certain catatonic state. That has to be gauged by person's weight, by the person's size, by the amount of the drug administered, and the calculated average time span for which the effects will take place. Now, the blood-brain barrier is one of the most important things to be taken into consideration when that is happening. Any overestimation or underestimation can severely affect a person being under and during something like surgery, or it can, or say an adverse reaction to a psychedelic drug, that bad trips, etc. I mean, there's a lot more to it, but the blood-brain barrier does play a role in those different things. So those are the main benefits of that structure in that sense. Um, so some cons of the blood-brain barrier. I've been going over its limitations for quite a bit now. The quality mentioned earlier of the diffusion of the brain barrier being destroyed, it can be a bit of a double-edged sword. As I went over a tad bit before, certain drugs and treatments for conditions like Alzheimer's, for example, are extremely difficult to treat due to the blood-brain barrier being a challenge to overcome in treatment. What that means is the diffusion of a controlled substance within the brain is often limited and doesn't have necessarily a permanent effect on a condition that is permanent and chronic and consistent, such as Alzheimer's or even something like dementia or Parkinson, other things that are deteriorations of the brain. Things that could potentially be repaired are inhibited by the fact that the blood-brain barrier prevents treatments from being as direct and as prolonged and as effective as they otherwise would be. And another thing that I mentioned before is, again, the structural thinness and weakness of the barrier. It actually, there's no um, protection whatsoever if anything within the circulatory system surrounding the brain tissues were to take effect. For example, an aneurysm. These are common cases of death, right? I don't want to say it's necessarily a structural or physical flaw of the human body. We evolved to be as efficient as we could be within the constraints and confines of what we had and what our bodies were able to do at the time that they evolved. Um, but again, it is a limitation, and any medication or any treatment or any sort of future plan that involves treating these conditions has to have that in mind, and it has to have that um, in a in a huge way to be kind of in emphasis on how is that going to be overcome and how is that going to be taken into account on a long-term timeline, right? Because these are chronic conditions, these are things that do not necessarily get better um, in any way over time with conventional methods of treatment. So that's just one of the main cons of the blood-brain barrier that I wanted to address. Yeah, so in conclusion, I just wanted to wrap things up and say that the blood-brain barrier is something I wanted to do a presentation on and go over because it is at a very high level of complexity and integrity to the human body, and it's often something that's not really considered by a lot of people. It's not really a structure that is given a lot of the importance in terms of its value, of its function, and if its role that it plays in maintaining the human body compared to a lot of other physical structures, right? It is sort of a secondary feature, but it's just as vital to the health of the human body. Were it not present, um, our brains and our circulatory systems overall would be at great risk of a number of things that would otherwise not be an issue. So it's worth noting, it's worth studying, it's worth going over, and thank you for listening, considering my take and my views on it. Thank you very much. This has been Eddie Barragon.